So when we do trach care on the patients, we do it usually once a shift, depending on the hospital. Sometimes they just do it once every 24 hours. And a lot of times the night shift does it right before they leave in the morning. You always want to make sure, they don't always change these trach collars, and sometimes the respiratory therapist will do it. It's important to make sure that the trach collars are still pretty secure. And with the trach collars, you want to be able to get your finger in here. If you can get more than a finger, then it's too loose. And if you can't get your finger in there, it's too tight. And you never ever release both sides at the same time. So if it's too tight, you can always, and these with the Velcro are nice, so you can always take it, and since these are Velcro, you can't do it. You'd have to, with the piece in the back. The ones with the ties are much harder, but most have the Velcro now. So we're assuming that this guy's was pretty good. When you're doing the trach care, some of the things that you're looking at are the area around the stoma in here, and that's what we're cleaning. Mm-hmm. So what we're going to do with that is we're going to have our trach care kit, and when we open this, we open it up and take out whatever's here. The sterile field. We're not going to use these, but pretend I have my sterile gloves on. Take everything, because this is what we're going to use to clean. But you have all your sterile stuff, so you can, or you can just take this onto your sterile field and dump it all out. See, these are the trach ties, and you should be very thankful that the Velcro stuff is there, because otherwise we would have to use these from before. This is underneath the trach. There's the gauze that already comes pre-cut. Don't ever take gauze and cut it like this, because the little pieces of gauze can get down into the stoma and cause infection. So make sure that you always use the ones that are pre-cut like this. And there's packages that are already cut. You use 50% hydrogen peroxide with 50% water when we're cleaning. So you would pour, do you want me to actually open them? Hydrogen peroxide. And your water. And you're going to only use half of this, because the other half is for rinsing out the inner cannula. So just do there, and then you'll pour the rest of it over here to rinse it out. So what we're going to do with the, you're going to take this piece here, and it clicks off. So you take it and it twists a little bit. You have to twist a little bit when you're bringing it out. Not too much, but then as that last twist, you kind of have to bring it out. So these, this is the inner cannula. This goes in the 50-50 mixture, okay? There's probably an order in which you brush and this, and, well, it doesn't really matter, because I don't remember the order. Does it say on there? Does it give a specific order? But basically, depending on how dirty these are, sometimes you have to let it soak for a minute or two, but if it's not very dirty, really all you have to do is take the little bottle brush and clean through it. And then there's all those, I forgot what these, what are they called, pipettes or something?
Pipe cleaners.
Pipe cleaners?
Pipe cleaners.
Yeah. And I have no idea why they have separate ones, but there's pipe cleaners. After this has been cleaned, you make sure that it gets rinsed off in the water. I think I already messed up. Pot in. But while that's drying, then you want to make sure, I guess it's fine, just, that's what I was trying to make sure. I wanted to pause what we were cleaning the site with. And if it's saying just use a saline, you can probably just dip this in here. But you want to just be careful to just kind of roll, don't dig, but just kind of roll the swab around to get anything that's dry and crusty around the patient. And don't use the peroxide because that's a pretty sensitive, it'll irritate the skin. And after you've done that, these, you always put a new gauze. And these go underneath, but this is how you know when people do or don't do trach care also, because these things will be all like dried and crusty. But you just always put one of the pre-cut gauzes underneath there. And then when this is dry, just don't ever touch the inner cannula part. And that's kind of the same thing. You just kind of have to go kind of sideways in the beginning, and then you have to twist it to go in. Okay, so with that piece again, because it's with here, you'd get it dirty, so sideways a little bit, and right as you're going in, twist, and then make sure that it locks in place. Because if it's not locked in place and the patient coughs, it can come out, so just always make sure you have it locked in place. But that's pretty much it with the trach care. It's making sure the stoma's clean, the trach tie is okay, and the important part again, you know, the 50-50 solution, and making sure you rinse it in nothing but saline, and make sure you don't touch the inner cannula. As far as these, really, I think they're kind of useless. I don't really know what. It's like if you use this and you clean everything out of it, I don't know the rationale for needing this, but I like these, they're cute. But that's pretty much it with the trach care. I mean, nothing